In the previous video, we have revised some content of the cardiovascular heart diseases, as well as the understanding from traditional Chinese medicine. In this video, we're going to come back to the case and see what we can do in this situation. So at 11:30, the patient started to feel chest pain, burning sensation. And then after 10 minutes, he took aspirin. And then when I met the patient, already half an hour. So what can we do? Firstly, when we see this patient, we need to diagnose what happened to that patient. And then we will see what we can do. So for this patient, the general condition of this patient, persistent pain for 30 minutes. Burning sensation, the location is behind the sternum. Pale complexion, sweating, and cold extremities. These manifestations matched the acute myocardial infarction, especially the duration. After 30 minutes, the patient still feels severe pain, the burning sensation. So angina must be relieved in a few minutes, especially after resting. If the patient still feels the pain, it must not be the angina. So when I see this patient, what I would think is at least I need to exclude angina, and if not angina, the patient has a very high chance to have an AMI, and this patient got a heart attack, the previous heart attack, so this is also a risk factor for AMI. The pathogenesis from these manifestations, the root cause is yang deficiency, the heart yang deficiency, chest yang. So this term is due to heart yang deficiency. Due to yang deficiency, the yang deficiency in the chest may affect the heart. The manifestation, stasis, blood stasis obstructs the heart meridian. So in this situation, what can we do? The treatment principles will be warm yang, warming the yang to dispel coldness, open the channels to stop the pain, or open the orifice or meridians to stop the pain. Why the coldness? Because the characteristics of cold can astringe does not to stop the flow, so we need to keep warm. So for the emergency principles, apart from our treatments, the first thing, what should we do? So the first thing I did at that time, I dismissed the people gathering around the patient. I asked them to keep quiet. If you want to stay far away and keep quiet. I don't want any noise because the patient need to rest. Resting in this situation, especially if you suspect AMI, sometimes in the hospital, we will use the sleeping tablets to keep the patient sleep more to reduce the consumption of the oxygen of the heart. We will require less relative visits, so the family do not visit that often, especially the relatives, because we don't want any disturbing. The less the better. So at this situation, what did I do is ask the people around the patient stay further away or even can keep on hiking, and then only the close friends stay there, keep quiet, keep warm, and then we need to liaise with 911. So for the treatment, this is what I did on the mountain. This video was a video that's because of this case has been reported by the media. The cameraman came to my practice to recall what have I done at that time. So that's what I have done on the mountain. Use a thumb as a needle from the hand, from 内关 pericardium 6, 内关, and the kidney 1. So let's see the results first. After all those arrangements, all those assessments, I start to work on the patient about a few minutes afterwards. These times are not accurate because I didn't keep the time there. That's from the record. Only a few minutes, I go over all the assessments and call 911, dismiss the people around him, and start to work on the patient. After 10 minutes, the patient says that the burning feeling feels softer. Keep on working, almost 1 hour. No pain, no any abnormal feelings in the chest. Now I continue the treatments for another 20 minutes. So I perform these treatments from 12 o'clock to 20 past 1. And now stop. At 1:30, the helicopter delayed. The patient requested to continue hiking because the patient has been feeling no pain for half an hour and everything will become normal. But I deny. I said, no, you have to sleep here, wait until the helicopter. At 2 o'clock, the patient requested again that he wanted to continue hiking to walk back. I said, no, you have to wait. 3:30, the advanced rescue team arrived. However, the patient got problems. The heart stopped beating. And in the meantime, because they are here, we start the CPR directly. And then 5 minutes to 4, the helicopter arrived. Then this patient was sent to the hospital in Pretoria. One of the reasons for here the cardiac arrest is because this patient saw the advanced rescue team and he was excited because he feel that he was safe. But all of a sudden, the heart stopped. That's why we said in this situation, we want the patient keep quiet. We want the environment to keep quiet. We don't want any disturbance. We don't want any visits from the relatives because we don't want the patient become excited. Exciting is kind of the factors of emotion. We don't want the patient to be excited because exciting will increase the oxygen consumption of the heart. This patient was sent to the hospital in Pretoria, and because of the CPR, his ribs were broken and results in pneumonia. So he was in the hospital for the treatment of pneumonia almost for 1 week. Only on the 11th of August, he went through the stent implant. But when you see from this case, from the 5th of August to 11th of August, almost 1 week, he haven't done nothing for the heart problem, but more for the pneumonia. But this case was very rare. The medical team came to my clinic after the patient had recovered. We came with the patient and they asked me, what have you done on the mountain? Because in this situation, there was actually no chance for this patient to survive, especially for this situation. The occlusion, the blockage, the severe blockage of the artery, and without medication, without any examinations on the mountain in the wild. This patient actually already recovered from the treatments on the mountain because from the 1st of August to the 11th of August in the hospital, we didn't do any intervention to the heart because the heart is fine. And they focused on the pneumonia. And on the 11th of August, they have done the stent implant. So this treatment, actually, this patient actually was saved with the combination of Chinese medicine and conventional medicine. And in 2019, the patient visited me again in the clinic. Still very healthy. So then let's come back to the case. What have I done at that time? The treatment principles will be warming the yang to dispel the coldness, to stop the pain. So that's what I emphasized in the previous videos. We have to stop the pain because the pain will result in anxiety. So I use one finger to press. Points I have selected: heart 8, heart 7, pericardium 8, pericardium 6, spleen 4, spleen 3, kidney 1, kidney 3 on both sides. The point that I'm focusing on is actually on the heart meridian, pericardial meridian, spleen meridian, kidney meridian. The reason is because this problem, this disease, is directly related to the heart. So for the heart problem, we can focus on the heart meridian and the pericardium. That's from our basic theory. The spleen is where the acquired qi comes from. The kidney is where the root, original qi, yin and yang comes from. That's why I focus on these four. But when you see them, this prescription, there were only eight points I have selected for the extremely severe cases, and also from the treatment I have shown you, that's not complicated. I use my thumb as a needle to press on these points. So what's important or what's most difficult for acupuncture is where to press, which points you're going to select. That's also why in our study we use so much time to discuss the theory, to discuss the basic theory, the diagnostics. We use a lot of time to train your particles, the needling technique, to train your hands. But if you can select the points correctly, the treatment is not complicated. It doesn't mean that for severe condition or comprehensive cases, you need to use more points. You need to use a lot of points. It doesn't mean in that way. If you can select the correct points, the result will be good. Why will I select these points and what's very special for these points? Kidney 1 is also Jingwell points. 腰忧腹, this is an article talking about acupuncture. The chest fullness, abdominal pain, we can use pericardium 6. 灵枢, this clause I didn't translate. It described as the different categories of 5 Su points, the spring coming out. So in English, you already have the term for the 5 Su points. The Jingwell points, the Xing spring, Su string. So you may just go through those 5 Su points. Pericardium 6, spring 4. These 2 points can be used for anything related to the chest, as we have discussed for quite a few times. Yongquan, this is the kidney meridian. The kidney is where the root yang and root yin comes from. This is also the Jingwell point. So I want to get the yang qi from the Jingwell, from the well. That's why I focus on Yongquan. Kidney 1. The heart, the Shao Fu, Shao Cong, heart 8, heart 7. These are Xing and Su points of heart meridian. Pericardium 8, this is the Xing point of pericardium. Spleen 3, that's Su points of spleen. Kidney 3, that's Su points of the kidney. As you can see from this prescription, out of 8 points, 5 of them are either Xing points or Shu points of specific meridians. Then why I choose the Xing or Shu points? Because the Xing and Shu points can be used for diseases that are related to Zhang organs. Lin Shu, the second volume of Huangdi Neijing, it describes that diseases in the yin of yin need the Xing and Shu points of yin. When you see this cross and chart, that you must be confused. What does it mean? By disease of yin of the yin of yin need the Xing and Shu points of yin. So when we see the text just above this sentence, Lin Shu is described. Therefore, there are yin and yang in interior and exterior. In interior, the 5 Zhang organs are yin, while the 6 Fu organs are yang. The exterior, the bones and tendons are yin, the skin is yang. So what does it mean here? The yin of yin. So it actually describes that the yin from the interior and exterior. Interior, the yin of interior. Interior, we're talking about the Zhang Fu organs. The Zhang organs are yin. The Fu organs are yang. So, which means the disease in the yin of yin, it actually means the disease of Zhang organs. The yin, the disease of interior Zhang organs. The yin of interior. So that's the Zhang organs. We can needle the Xing and Shu points of yin. What's this yin? We can needle the Xing and Shu points of this meridian, the Zhang organs meridian. The heart, the spleen, the kidney, these are all yin meridians. So that's why Xing and Shu points can be used for diseases related to Zhang organs. The Xing and Shu points of yin meridian or Zhang meridians, they can be used for diseases to the Zhang organs. In the other clause, Xing and Shu points are used for diseases related to exterior meridians. When you compare these two sentences, it seems that it conflicts. One I said it can be it can be used for interior. Now I said it can be used for exterior. The reason is because these Xing and Shu points are different. Again, in Lin Shu, pathogenic qi in the heart, you see that the Shu points of the Han Shao Yin meridian of the heart. Qi in the lung, see that the Xing points of the Han Tai Yin meridian and Shu points of the foot Shao Yin meridian. On this text, it still emphasizes that the organs, the Zhang organs, the problem, you're going to see that the Shu points, the Xing points of the specific organ. The Han Tai Yin, that's the lung meridian. The Han Shao Yin, that's the heart meridian. You're going to use the Xing and Shu points of these meridians. These meridian points can help the Zhang organs. However, in the other tests, you can see pathogenic qi in the heart, select blood 10, blood 11. If the patient is not healed, select the Xing and Shu points of the foot Taiyang meridian. Pathogenic qi in arms and feet. Remove the blood first, stagnant blood first, and followed by Xing and Shu points of the Yang Mi meridian and Shao Yang meridian. The reason why this clause, the Xing and Shu points, can be used for exterior meridians is because here, the Xing and Shu points of Yang Mi can be used for problems that are related to the arms and feet. The exterior. When you compare with internal organs, the arms and feet, or the legs are exterior. So it actually means the Xing and Shu points of Fu organs or the Xing and Su points of yang meridians can be used for arterial meridians, diseases that are related to arterial meridians. So that's the reason why I cited those points. And the theory also from 黄帝内经, the Xing and Su points. The Xing and Su points of 12 meridians. How do you use them? In which situation you will select Xing and points or Su points? You're going to consider the yin and yang nature of those meridians. So what are the key points of this case, or the successful key points of this case? Firstly, this term is the correct diagnosis, because this is an image, so I can't change the Chinese character. The first one, the correct diagnosis. The second key aspect is the correct treatment principles and prescription. Ensure the successful of the case. Correct diagnosis, the correct treatment and prescription. Now I want you to think about another situation. At 1 o'clock, the patient already presents no pain, no abnormal feeling, no other sensation at all. And then after half an hour, the patient requested to continue hiking. If at half past 1, or even at 1 o'clock, because at 1 o'clock the patient doesn't, because at 1 o'clock the patient didn't feel anything discomfort. If I leave at 1 o'clock, what will happen? That's why I said the correct diagnosis is very important. The correct diagnosis, if this patient was angina at 1 o'clock, I can leave the patient. The patient can leave, can rest, can leave. But because this patient is not angina, it's AMI. That's from the correct diagnosis. You need to know this is AMI, not angina. For AMI, you need to keep the patient there. You need to wait until the rescue team, or you need to wait for the helicopter. Because this patient, in this situation, more than half of this patient will pass away. More than 50% will pass away before arriving in hospitals. So from this case, we will see this the treatment for chest pain. Firstly, to protect the yang qi. This yang qi very important for the circulation. Warm the yang and open the meridians, stopping pain. The patient must be resting. You must ask the patient to rest. Keep quiet. Don't ask the patient, do you feel better in 5 minutes? After 5 minutes, ask the patient again, do you feel better? Please do not do that. Try not to disturb the patient. Keep the patient quiet. Try to sleep. We need to understand the disease from multiple viewpoints, including all the diseases from conventional medicine point of view. That's the reason why I stay there for a few hours, wait until the helicopter. Although we need to understand from conventional medicine point of view, but when we perform our treatments from Chinese medicine or acupuncture, we have to analyze from our theory, the main syndrome, and then the pathogenesis. Our treatments will be based on the pathogenesis. In the treatments, we need to think from Chinese medicine. Otherwise, you will be in trouble. Stop pain, you don't have any medication. How could you stop the pain? So in this situation, you need to think about our theory. Where does the pain come from? Either malnourishment or blockage, or both. It can be either or both. So our treatments will focus on these from acupuncture and moxibustion, or herbal medicine if in the cities, if you can. And the last conclusion that we can see from this case is the value of the classic texts. We can use both acupuncture or herbal medicine, but the value. You see, all these theories, all these principles that I apply in clinics are from the classics that were written in 2,500 years ago. We need to understand the principles. We need to apply the principles in our practice. That's the only way to achieve the efficacy, as well as the way to simplify your treatments or your prescriptions. We have so many points all over the body. We have so many points in specific meridian. Why I said these 8 points instead of other points? That's from the classics. So these are the discussion of the angina, although we also introduce AMI. These are very common diseases, very common coronary heart diseases. So when we see patient present with chest pain, we need to keep in mind to exclude some other severe conditions. Although we have introduced a very successful case from acupuncture on the treatment of AMI, in practice, next time when we see those kinds of patients, I still have to emphasize that we have to send this patient to the hospital. This is for the safety of your practice as well as the safety for the patient. You are not recommended to treat this severe condition in your clinic, especially in South Africa. But in the practice, you may encounter a patient suffer from chest pain, but actually was extreme severe heart attack. That's why we need to understand what we can do and what we cannot do at this situation, as well as to have an in-depth understanding of diseases. Thank you for your attention.
I had 2 friends out from India who wanted to go hiking, and I took them to the Moxibustion. We'd probably got about 3 kilometers into the hike, and we'd just come out onto the plateau at the top, and that's when I realized I was in trouble. You know, I knew, okay, when I stopped on the top of that mountain, and I started getting my breathing right, okay, but my heart kept on racing. It was about 5 or 6 minutes into the heart attack that Dr. Hu and 2 of his friends came around the mountain.
On top of the mountain, we met the guy there. Because when we passed, someone said, is there any doctors there? So it's just actually lucky for him. He was in a very severe condition, so we used acupuncture to help him, waiting for the helicopter.
He sat down next to me straight away. He didn't say anything. He just worked on my left wrist for about 10-15 minutes. Then he went to my opposite wrist and he carried on.
On the hand, around the channel there, and we call the heart channel or heart meridian.
Somehow he managed to keep my heart from actually just going over the edge. A whole 4 hours into the heart attack, a friend of mine managed to drive from Johannesburg all the way to the Moxibustion. The minute the doctor stepped aside and the wilderness guys took over, my heart stopped right there and then. Boom.
Eventually they sent a helicopter and the patient was sent to Pectoris.
The wilderness medics then managed to keep me going for 10 odd minutes and revived me completely.
From the cardiologist, he said there are no successful reports. A patient in this situation can be survived. Even if it happened in the hospital, it's not easy to survive.
Now that I actually go back, okay, and think about it. There's no ways I could have survived 4 hours of that Doctor Who. Chinese medicine, I have an incredible respect for, and I have a lot of respect, in particular for Doctor Who, for what he did for me that day.